We're here with Amber Mitchell
Yes.
from, I won't get the name completely right, but I know it's Occupational Health Caucus. Can you tell me your full name?
It's the International Health and Safety Section.
Okay.
Made up about 800 members.
Oh, wow.
Yes.
Very
We're one
large.
of the, I think we're the second oldest section within the American Public Health Association.
Really?
Yeah. We're celebrating this year our 107th anniversary.
You don't look that old, Amber.
Thank you.
107 years.
Yes.
Amazing. So what was the section originally founded? What were the drivers? I can imagine the topics 107 years ago were maybe a little bit different.
They were. So our section focuses on the health and safety of people who work.
Mm-hmm.
A lot of the working conditions 100 plus years ago were very different than they are today. We have focused on issues related to different aspects of occupational health and safety.
Mm-hmm.
So occupational health might be an exposure to hazardous chemical at work and what that means for the manifestation of a respiratory disease or lung cancer or skin cancer. And then on the safety side, we think more about physical hazards. So fall protection in construction or overhead hazards in any workplace. Most people that are walking around the convention center today are working. And so we really feel that at the core of public health is the ability to keep a person who is working safe so that they can go home to their families and communities and be a productive member of society.
You know, we so take that for granted now. It's hard to imagine that 107 years ago, that was probably really pushing the edge of the conversation.
It was that long ago, we didn't even see elements related to workers' rights or worker safety. Many workers were wage workers. There was no unionization or labor movements. And coming then out of the civil rights movement, where we're thinking about human rights for all, we're also really thinking about increasing or amplifying the messages about workers' rights and worker health and safety.
Now, Amber, help our viewers understand the difference between a section and a caucus. APHA is a big, amazing, complicated thing. So help us understand that. You don't know the difference.
I don't know.
Okay.
I know the difference. I know that we're a section and then there's a caucus and a special interest group, but I don't know.
You don't know what makes one.
I don't.
One
That's
the
a
other.
great
I
question
see.
for an APHA staffer, that's for sure.
Great.
Yeah.
And now I know the caucuses often have dinners during this conference and various meetings. Do you do the same?
Absolutely. I would like to say we are the most fun section.
Okay.
Last night we had a social hour for our section. Tonight we're having a social hour for students and new members. I really think it's important for students to realize that socializing within a network of people that share some common goals, some common thoughts, who are looking for jobs and experiences come together in a social environment. And then tomorrow night we have our big dance party.
Oh.
So we charge at the door for people to come and dance the night away, have food and drinks so that we raise money for scholarships for occupational health and safety students to come to APHA. So coming to the conference can be cost prohibitive in a lot of ways, and so any way we can raise money to get students to come to the conference, we're all in. So we do that every year.
And tell us a little bit about Amber. Where are you from, and what's your...
I'm originally from Washington, D.C.,
Okay.
which is a rarity. People say they live there, but I was actually born there. I've lived all around the country. I've worked in the federal sector for the Occupational Safety and Health Administration. I've worked in different academic settings for medical device companies, and now I run a nonprofit, which is very, very different skill set. In public health, you get a lot of the scientific, clinical, and technical background. but you don't really get any entrepreneurial background.
Right.
We talked earlier about communication styles and multimedia and how important it is, especially if you run a small nonprofit, to get that voice out there. Resources that a large university may have or a professional organization like APHA, but not so much a small nonprofit.
Tell us about your
Sure, yeah. We focus on the health and well-being of healthcare workers.
Okay.
So the safety and health of those working in healthcare, not just in hospital settings, but long-term care facilities, school health, public health nursing, community health workers, making sure that they're safe and well. The occupational exposures that healthcare workers experience are very different than the general public. There are exposures to infectious disease like tuberculosis and the flu, needle stick injuries that could expose a worker to HIV and hepatitis. There's a lot of issues with workplace violence in healthcare settings. Also slips, trips, and falls. I mean, a healthcare environment is a big physical environment also. So we make sure that healthcare workers are well so that they can take care of the patients that they care for. We say at the center, there is no healthcare without healthcare workers.
Right. Wow. That's a good phrase. What is the name of your?
It's the International Safety Center.
Okay. Wow. Interesting stuff. And that is located where?
I live in between Houston and Galveston. We are a modern day organization. We are 100% virtual.
Okay.
So we have experts and faculty members from all over the country, mostly in Virginia and Texas. But we take expertise. Our surveillance program, which is called EpiNet, is used to capture incidents from injured healthcare workers, and it's used in 90 countries around the world.
Wow.
So we are 100% virtual organization.
Amazing. What is your role in the section, the occupational health section?
I came up within leadership of the section. I started as a student, and I knew that I really wanted to be active, mostly for networking and mentoring, because I was new coming in. And I'm now the Occupational Health and Safety Chair, actually, for 2019.
Wow.
But I served many different positions: section counselor, program planner. And really, I did it for selfish reasons, because I felt like I needed the skills, the organizational and administrative skills to help run a section, which is very different than having the academic, scientific rigor that it takes to be a professional in public health. So I wanted to balance those business skills that the section gives you as section leadership with the technical skills that a formal public health education gives you.
I see, great. And does the section, what other activities or programs or awareness efforts does the section run throughout the year between APHA events?
We do a lot during the year. We really like to focus on what our membership organizations are doing. So if a university has we have Workers' Memorial Week. If an organization is doing a Work Safe program, if a union is doing some kind of local advocacy work, we'll showcase all of these activities on our website and through email blasts and Twitter and Facebook and LinkedIn. We also do ongoing webinars. We have a podcast where we interview members, but we're always looking for opportunities to expand people's knowledge of occupational health and safety, because I think people think more traditionally of public health messages, meaning a message to the community at large. And I think that since the majority of all people around the world work, that we have an opportunity to share public health messages in a workplace, but also how important it is to be well and safe at work, meaning if we are going out into the environment doing work, that we have the right to come home safe.
Wow, interesting stuff. Any final thoughts?
I just thank you for helping us to get our messages out there. I think it's really important that we're able to do it in a multimedia way. Video, I think, is really meaningful because you get to see the people and the heart behind public health in general. But for us, the people seeing the face of occupational health and safety is really meaningful. So I thank you tremendously.
Thank you.
Thank you.